Have you been diagnosed with depression, high blood pressure, type 2 diabetes, or even a condition we call fatty liver? These are some very, very common medical conditions that many of us are familiar with. But one common factor that runs through all these things I just mentioned is obesity. Obesity is the background of all these diseases that we just talked about. And having said that, there are also many more diseases that are tied to obesity. Even certain cancers are tied to being obese. So being obese is literally the root of a lot of the problems medically that we see as physicians today. Therefore, I wanted to talk to you about this because you have to understand that your medical conditions are not independent events that are happening with no connection to each other. They are truly connected. So many times people, see their primary care doctor. In 1 year, they get diagnosed with acid reflux. Next year, they get diagnosed with sleep apnea. Now they have to sleep with a machine. Next year, they have to take cholesterol medications. And they think that these are all independent events, but truly, they're all tied to obesity. I believe that if we are able to address the root of the problem, then we can address the whole problems themselves, right? So that is why we focus primarily on weight loss options here at AMG Weight Loss. So what we offer is unique and is in the field of what we call endobariatrics. So these are non-surgical options where patients can have effective FDA-approved weight loss procedures that does not require surgery, which is a big deal. Not everybody has the appetite for surgery, and frankly, not everybody needs surgery. And there also are patients who do need surgery but cannot even have surgery because their medical conditions prohibit them from being able to undergo that type of anesthesia and that type of surgery. And we've been able to help those people through endobariatrics. So there are several procedures that we offer to help address the obesity problem that we're seeing in America and around the world today. These procedures include the balloon procedures like Obera, SPATS balloon, and of course endoscopic sleeve gastroplasty, which many of us would consider a non-surgical version of the gastric sleeve. And for my dear patients all around the world who have gained weight after gastric bypass or after gastric sleeve, many of you underwent those life-changing procedures. You underwent those life-changing surgeries with the hope that it was going to be a permanent solution. You fast forward 10 years down the road, 12 years down the road, sometimes as short as 3 years down the road, you've gained back 50 pounds, you've gained back 70 pounds. And now you are literally feeling like you are a failure and you have no other option. Well, we've come to bring good news to you, that you do have an option with endobariatrics. And this is a procedure we call bariatric revision. It's offered here at AMG Weight Loss. So we are so excited to be able to do that for you. And I encourage you, visit our website, call our office and come see me face to face, and we'll be able to find and customize the best option for you. The key thing is to understand today that many medical problems that many people are taking pills for on a daily basis are tied to one root problem. And I believe if we cut the tree by the root, we don't have to mess with the branches anymore. That's what we do here at AMG Weight Loss.